going to be making an occupied bed. So that means the person is in the bed, therefore it is occupied, right? So bed changes are a necessity. We're gonna make sure that we're changing these sheets as needed, and then at least once every couple of days, because they do get dirty pretty quickly, okay? So the very first thing we're gonna do is our pre-procedural skills. We're going to knock on the door, enter into the room, shut the door for privacy, walk over to the patient and introduce ourselves. We're not gonna touch anything. So good morning, Mrs. Smith. My name is Lori, I'm your CNA, and I just needed to change your bed sheets, okay? So I'll be right back, I have to go wash my hands. I go and I wash my hands thoroughly. If this is the very first skill, I'll get checked off on it. If it is a second or third skill, then I would just say to the nurse, at this time, I know I need to wash my hands. I am going to use gloves. So in the state test, these gloves are really optional. I always teach you to wear gloves because in real life, you would never change a bed without gloves on. Too many things can go wrong. So I'm gonna go ahead and put these gloves on. But as you notice, I only have one pair of gloves on here because we do not need to do dirty to dirty, clean to clean for this one. All right, so we are going to have a barrier for our table. And I just wanted to show you some of the stuff that we have on here before we proceed. We've got our pillowcase, which is gonna be last. I've got my flat sheet, which will be before that one, and then my fitted sheet, which is always first, okay? All right, so once I've washed my hands, I came back, I asked the patient, can you give me your name, your date of birth, and your ID bracelet? So we've already checked all that. I've already got all my equipment, so now we're ready to actually deal with the bed. So we're gonna go ahead and raise the bed up so we don't hurt our back. And remember, the pillow is the last thing that you will change. How you doing today, Mrs. Smith? Good. All right, so what we're gonna do is we're gonna go ahead and change your sheets, but I'm gonna need you to kind of come towards me a little bit if you can. And then we're gonna adjust your pillow here just a little bit so your head, when you turn, you still got pillow there. So if you could you roll over to the side for me? Good. And just, we wanna make sure you're not too close to the edge. So the patient can roll for you. This is a real person in the bed for the state test. They basically can follow all of your directions. The checkpoints for safety are making sure that your patient is not getting too close to the edge of the bed. So if you think that when she rolls, she's gonna be way over there, have her go towards you first, then roll so she'll be right in the center of the bed like she is now. So Mrs. Smith, I'm just gonna go ahead and untuck or undo these sheets here. You're gonna feel me kind of roll them up and put them behind your back, okay? So we're getting each end. I can kind of lay this up on her hip so that way she's not rolling into it. And we're just gonna roll the sheets toward the patient. Roll the sheets toward the patient. And we're just gonna kind of move it up underneath them. Now we're gonna get the clean sheet. So we're gonna take the clean sheet. Remember what I told you, there's no fluffing, we can't shake stuff. So we kind of have to figure it out. Just lay it on the bed, look for the corners, make sure that you've got the right side, okay? So you do have to kind of untangle it first. And then you can hook one corner, and then you're gonna come over here and you're gonna hook the other one. So just make sure it's not twisted up. So I'm gonna go ahead and hook this one. All right, so now I'm gonna kind of roll the sheet towards me, and then we're gonna tuck it up underneath her. All right, Mrs. Smith, so we're just gonna tuck this up underneath you so you're gonna feel that. All right, so once we've got this on, we can tell Mrs. Smith that we want her to turn, but make sure you're kind of smoothing the sheet out. All right, Mrs. Smith, you can go ahead and turn back now. Good. You feeling okay? All right, so I'm just gonna move to the other side. And this is a very fairly quick skill for the state test. All right, Mrs. Smith. So I just want to make sure that we're not rolling you too close to the edge. So if you want to scoot a little bit and then go ahead and roll, perfect. You're doing a great job here. And we're just going to go ahead and close off. How's your head? Is your head okay? Got it? So check their head and their neck to make sure that they're not off the pillow. You're going to peel off the dirty. Don't let it by your clothes. Drop it off into the basket. Get the clean and hook them up. Please, again, make sure that this is nice and tight before you turn the patient. So Mrs. Smith, if you want to turn onto your back now, There you go. And you can just tuck any excess on the side. All right. So now it's time to do the top sheet. And yes, you are going to take the clean top sheet and you're gonna lay it right on top of that dirty one. Because in what they're thinking is that the dirtiness is up underneath where it touches the patient's skin and not on top of the sheet. So we're just gonna lay this out and we're gonna try to figure it out. Not all the times are they folded the correct way, and there's all kinds of stuff that go on. So look for the tag. So here's the tag. This means this has to be the end. All right. So we're gonna put the tag end over here. And then the rest of it will go this way. So the way that they want it is they want you to pull this all the way up and do a fold all the way up to the top of the shoulders. That's important for the state test. At the end, I try to just pull this out a little bit. So now once I've got this on her correctly, I'm gonna have the patient hold this with one hand. So Ms. Smith, can you hold that? Great, thank you so much. And we're just gonna move this off of you, okay? So remember what I told you, you can go up underneath and you go pull, 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 pull. And it makes it a lot easier, pull, pull, pull. Quick little jerks. So that way it pulls out easy without you having to pull the whole sheet off. All right, thank you, Mrs. Smith. Now we're gonna go ahead and we're gonna do the mitered corners. So we're going to hold the sheet, we're going to lift up the mattress, pull this up underneath, and let it down. So if you wanna come and watch me on this side, again, you're gonna hold the end of the sheet, you're going to lift the mattress up, you're going to pull this underneath. When you let the mattress down, you'll see how this looks. We're gonna go from the corner of the mattress straight down, and we're gonna grab the material and we're going to pull it to the edge of the bed. Once it's to the edge of the bed, we're going to tuck what's left. And then we let this fold back. This is called a mitered corner. Same thing. I already tucked it up underneath. I'm gonna go straight to the end, pinch it, pull it all the way to the edge. Whatever is left is what I tuck, okay? There is a checkpoint on the state test. You need to loosen the sheet at the toes. Make sure, can you wiggle your toes for me? Perfect. All right, so the last thing that we're doing is the pillow. So Mrs. Smith, I'm just gonna go ahead and take your pillow from you. If I can have you lift your head. Great, there you go. And so you're just gonna hold the pillow and pull this off. It should slide right off. You can lay the pillow down, pick up your sheet, scrunch it all the way up, like you're gonna put on a pair of pants. On the back side, you're gonna find the center. So here's the corner, so here's the center. And I'm just gonna grab it, like I'm making a fist, and I'm gonna put this over my hand. So you can see my fist right there. I'm gonna use the tag side and I'm gonna grab the middle of the pillow. Flip this upside down and just peel it on. See how that works? So we don't need to tuck it up underneath our chin. We don't have to do anything like that. It's very easy to put this on. The opening needs to go always away from the door. So there's no door here on either side, but if it was, we would make sure we do that. So Mrs. Smith, can you lift up your head? Good. Is that comfortable for you? Perfect. All right, Mrs. Smith, so we're gonna go ahead and we're done with basically the skill. I can go ahead and get rid of this. I can bring this over to the patient. That way they have access to it. I can remove my gloves, throw this into the trash, And then from there, I'm gonna do my calves. So here's your call button. If you need anything, just press the little red button there, okay? Are you comfortable? Would you like a magazine or a water? Okay, great. I'm gonna put your bed all the way down. We're gonna go ahead and open up our curtain. And our last little bit for this skill is gonna be to go and wash our hands and then say, skill complete.